During a central line dressing change, the bedside nurse must be vigilant to protect the patient from possibly life-threatening complications from having a central line. The same careful, sterile technique should be used during the dressing change as was used for the original line insertion. Not only must your technique be meticulously aseptic, but your assessment of the line will provide important information for the nurses and doctors caring for the line and for your patient moving forward. In an effort to decrease the risk of central line bloodstream infections, we have created a central line dressing change kit that will help you follow all the important steps that protect your patient with a central line. Research has shown that standardizing central line care is the most important variable to decrease line infections. Our sterile dressing change kit has pockets that contain the products you need to perform the dressing change in sequence. The outer portion of the kit has everything you need to remove the old dressing. And then the inner pockets of the sterile kit have everything you need to apply the new dressing. Before beginning, you will want to educate your patient and any family present on the procedure to follow. Give the limb or neck a quick cleaning with bath wipes to remove loose hairs, crumbs, or anything else that could pose a risk to your sterile field. If there is a chance the patient will not be able to hold still or follow directions for the 10-minute procedure, find another person to assist in holding the patient still while the line is exposed. Provide for the patient's comfort, anticipating any needs for toileting, pain, or nebulized medication or hydration. Close the door to diminish air circulation and put a sign on it stating, "Dressing change in progress, do not enter." Pull the curtain separating patients in a shared room. Remove all personal items from the bedside table and disinfect it thoroughly with bleach wipes. Position the patient for comfort and ease of access to the line. Clean the bed rail or lower it if it's in the way. Don your procedure mask and put a mask on the patient and anyone else helping in the room. The dressing change kit contains a vial of alcohol rub. Put on your gloves and begin to remove the old dressing. Lift the lumens and find the V-shaped notch on the securement tape strip. Pull apart the V and the perforation, allowing the tape strip to break apart for easy removal. Roll the tape strip and the 3M Tegaderm dressing back to expose the securement device. Use detach-all per policy and manufacturer instructions. It's included in the kit. Remove the securement device per the following steps. Remove adhesive tape strip, also known as the safety belt, from the lumens. Carefully slide the lumens out of the open end of the securement arm. Remove the line off the securement posts and set aside gently. Remove the securement device by gently peeling off the patient. Silicone adhesive on the device should make it easy to remove without detach-all or alcohol. Remove the 3M Tegaderm dressing by peeling low and slow toward the insertion site. The biopatch should remove with the 3M Tegaderm. If not, remove the biopatch after the 3M Tegaderm is fully removed. Now you're going to flip up the drape and enter the second sterile area and continue with the application of the dressing. Don't forget to remove your old gloves and clean your hands with the gel that is provided, the hand sanitizer. Apply your second set of sterile gloves. Now it's time to cleanse the site. The first stick of the ChloraPrep swab sticks is used to remove any exudate from the site itself. All the dried blood, all the crusty stuff should be removed with that first stick. The following sticks are used to cleanse the area in a vigorous up and down, back and forth motion, extending beyond where you anticipate the dressing will lie. Include the area where the securement device will be. The cleanse time must be a minimum of 30 seconds. Watch the clock. In a groin area or the axilla where there's more bioburden, you will need to scrub for a full 2 minutes. The area must be allowed to dry completely before moving on to the next step. If any of the ChloraPrep vapors are trapped underneath the tegaderm, it can cause serious burns. Enclosed in the drape kit is an extra piece of tape that you can use to secure the lumens and keep them from flopping around. This is in the sterile area in one of the pockets, and you would not be leaving this on the patient, but it's very handy when the patient may be twitching or moving, or if you have a jugular line up on the neck that you need to position the tubing in a specific way. Once the ChloraPrep has dried completely, apply the Cavalon's No Sting Barrier Film. Use even strokes, covering one area of the skin, then moving to the next area, anywhere the tegaderm will be applied, but you need to avoid the area directly around the insertion site where the biopatch will be placed. Do not move from an uncleansed area to a cleansed area to avoid contaminating the site. Allow the Cavalon to dry completely for 15 to 30 seconds. Do not fan the area and do not blow on it. Apply your biopatch with the blue arrows, the arrows on the blue surface pointing towards the needleless connectors. Apply the 3M securement device in the following manner. Gently lift the catheter hub enough to clear the catheter securement posts. Align the catheter hub with the embedded purple image of the catheter that is printed on the device. Abut the catheter hub up against the securement posts. There are application instructions that are attached in every tegaderm dressing kit. Guide the lumens under the open end of the securement arm, lining up the lumens in the securement channels at the bottom of the device. Grab the red and white 3M strip and peel back to expose the adhesive tape strip. This will act as a safety belt to keep the tubes in place. To secure the device to the patient, hold onto one side of the device and pull the blue tab to the opposite side. Apply gentle but firm pressure and smooth the device onto the patient's skin. Repeat with the other side. Apply the tegaderm dressing in the following manner. Remove the application and removal instructions from the back of the Tegaderm dressing and refer to them if you need to. Peel the Tegaderm dressing off the green and white paper backing and hold by non-adhesive handles. Do not touch the sticky area. Align the flat edge of the Tegaderm dressing to just cover the securement arm on the securement device. Remove the paper frame from the borders of the dressing and smooth the dressing to the skin using gentle but firm pressure. You don't want to tap it on there, you really want to iron it on. Cover all the areas and smooth it out completely. Massage it into the skin. Take the rectangular handle on the securement tape strip and peel off the backing, holding the non-adhesive handle. Lift the lumens with one hand and align the securement tape strip to the distal border of the Tegaderm dressing, covering the remainder of the securement device. At this point, your hands aren't clean anymore, so because the insertion site is covered, you can manipulate the unclean caps. Remove the paper frame and smooth onto the skin using gentle but firm pressure. Apply date label tape strip across the securement strip notch to seal the Tegaderm system. And at this point you can tug on the line and you'll see that it's not going anywhere. Once the dressing has been changed and dated, it's time to change the needleless connectors. Again, using your cleanest technique. You'll want to clamp the line, take off the old connector, you're going to use a site scrub to scrub the hub without the connector on it. 8 seconds of scrubbing. Apply a new connector and a new Kuros cap. You're going to repeat that with each connector and use a different site scrub for each hub. If you needed a blood culture drawn, you would draw it with the line looking like this. Do not draw a blood culture through the needleless connector. And when you do a blood culture, make sure you draw a sample from each lumen. And there you have it. Thank you for your attention to the important details of this procedure. Your patient will also be grateful for your careful skill and attention at this vulnerable time when their central line is exposed and risk of contamination is great.